Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition muscle strains. By definition, strain is an overstretched injury to a musculotendinous unit, which is the muscle, its tendons, their osseous attachments, and the musculotendinous junction. Okay? While it may occur to any muscle, it most frequently affects the muscles of the lower limbs. Okay? Causes of strains. A sudden overstretching of the muscle, okay? An extreme contraction or shortening of the muscle against heavy resistance. So you guys, if you are constantly lifting heavy loads, then eventually you'll get strains on your muscle, especially on the lower limbs, okay? Contributing factors. 1, inadequate warm-up before an activity, especially during exercise. So make sure you do warming up, adequate warm-up before you do an activity or like exercise. Okay, so limited flexibility. Okay, so if your limbs have limited flexibility, then you may get muscle strain. So fatigue. Okay, if your muscles you feel you feel exhausted or you feel fatigued, then when you force yourself to do activities, then you may get strain on your muscles. And repetitive overuse or overstressing of the muscle. Overuse, so you use your muscles or you're doing repetitive work or lifting heavy stuff or overdoing exercises repetitively. All right. Another is a strength imbalance between the muscle and its antagonist. Okay, imbalance meaning the muscle that you are using or that's working, there's too much strength on that, and the antagonist, the muscle that supports, that supports the action, then it cannot support the load or the strength of the muscle that's doing the work or the action. Then there will be imbalance. Okay, a history of previous strains to that muscle. So guys, if you're using your muscle that has a history, you've enjoyed that or you've strained that previously, and then you're still using that for strenuous activities or lifting heavy stuff, heavy loads, then you may get a repeated strain on that muscle again. Then altered that place stress on the muscle. So altered that place stress on the muscle. Okay, so that's one contributing factor that the muscle or tendon or osseous attachments can get strained. All right. Okay, there are other soft tissue injury that may occur with strains. So you can get sprain, contusion, dislocation. Okay, so this may occur when you get this, when you get your muscle strain. Okay, there might be sprain or contusion or dislocation of the tissue or maybe the bone. Okay, now classification according to 3 levels of severity. So strain are classified into 3 levels of how severe the strain is. Okay, so there's grade 1, which is mild or first degree strain. Now this means that a minor stretch and tear to the musculotendinous unit. Okay, so there is minimal loss of strength as well. Okay, and the person can continue with the activity with mild discomfort. So minor, very minor, okay? The minor stretch and minor tear, okay? Or maybe stretch only for grade 1. Now, so the next is grade 2. So this is moderate or second degree strain. Now, with grade 2, there will be tearing of the musculotendinous fibers that will occur. So we mentioned about musculotendinous. It could be muscle, tendons, and osseous membrane on the area. Okay? So there is now tearing. There's a tear. The degree of tear is quite variable. So it varies from several fibers to the majority of the fibers. So just sometimes the strain, grade 2 strain could include only a few, several fibers, but and to the extent of majority of the fibers. Okay, so there may be a snapping sensation, snapping sound, okay, like a tick sound, snapping sound, or sensation or sound at the time of injury. So at the time of injury, if you hear there's snapping sound or sensation, then it could be grade 2 strain. A palpable gap may appear at the injury site. Palpable gap. So when you palpate the injury site, you will feel a gap. Okay, you can palpate it. There's difficulty continuing the activity due to pain and muscle weakness. So now if you get grade 2 strain, you have difficulty continuing any activity due to pain. So it's painful and the muscle is weak. All right. Comes the grade 3 strain. So it is severe or third degree strain. Okay. So with grade 3, this is a complete rupture. Here you go, guys. So when there's a complete rupture of the musculotendinous unit, either the muscle or the tendon or the osseous membrane, okay? The osseous membrane is the one that attach the the muscles or the tendons around the bone on the area. And a avulsion fracture. Okay, so there is like a little fracture on the, so because it attaches to the bone, then it is like a tear from the avulsion fracture, the attachment from the bone. As the bony attachment of the tendon is torn off, here you go, guys, while the unit remains intact. Okay, the attachment, the bone is attached to the tendon, from the tendon is torn off while the unit remains intact. Okay, there is a snapping sensation or sound. Again, you're gonna feel a snapping sensation or sound at the time of the rupture. So when it happens, you may be thinking of either grade 2 or grade 3, depends on the tear of the tissue. A palpable gap and often visible appears at the injury site. So the gap is often visible. So you're gonna see that there's a gap, a palpable gap. Often the muscle shortens and bunches up. Okay, here you go, guys. So it shortens the muscle and it bunches up. Okay, it's like a swollen area. Person cannot continue the activity due to the significant pain and muscle weakness. So pretty much, if you get this third degree strain, you cannot continue with any activity with the area, with the muscle, because of very painful and the muscle weakness is significant. Okay, there are stages of strain. So one is acute stages. Now in acute stage, the client should be referred to a physician if the health history reveals that there is significant muscle weakness, loss of function, or a palpable gap in the tissue. So if it is grade 2 or grade 3, these symptoms are showing, then you should refer your client to the physician right away. Next, inacute grade 3 strains. So, in this stage, muscles and tendons may be surgically repaired. Okay, surgically. So, it will involve surgery repair. If the injury is left to the chronic stage, the ends of the tissue fibrose and make surgical repair difficult. So when a client, you know, strained his or her muscle and comes to you for, treatment, fortunately, you're just gonna, assess the stage of the strain, and then you're gonna advise the client to see a physician and, help the client as much as possible. Do not let the client, you know, leave the injury to stay longer to chronic stage, because the tissue there that's affected will harden, fibrose, okay? And it's very difficult for surgical repair. So after the acute stage has passed with grade 1 or grade 2 strain, it is important to first maintain and then increase the range of motion of the joints crossed by the affected muscle, the muscle that has been strained. Okay, so after the acute stage has passed, so passing acute stage for grade 1 and grade 2 strain, then you first maintain to increase the range of motion of the joint in the affected muscle or the muscle strained. It is also important to maintain and then progressively increase the strength of the muscle itself. Okay, then you proceed to increase and maintain progressively the strength of the muscle that has been strained. Okay, a period of total inactivity following a strain allows the injured musculotendinous unit to shorten and disuse atrophy to occur. Okay, meaning it's a condition where the muscle is shortened and there's fibrosis on the area, meaning disuse. It's not being used. That's why it's called disuse atrophy. The muscle atrophied of not being, for being with no activity. Okay, sorry, having no activity. Okay, it's very important after the acute stage. Acute stage is from like to 7 days. Then you're gonna start, increasing the range of motion and then progressively increase or maintain the strength of the muscle affected. Okay, so the muscles that are often affected by strains. There's the gastrocnemius, so this is the calf muscle. It's located on the back of your lower leg. Okay, usually occurs at the musculotendinous junction. It's from the tendon. Muscle attaches to the tendon, and the tendon will attach to the bone. So the junction is in between. Okay, tendon to the bone, or at the attachment of the Achilles tendon. The Achilles tendon is the tendon that attaches the muscle to the heel bone. Okay, so the gastrocnemius muscle attaches to the Achilles tendon, and then the Achilles tendon attaches to the heel bone. Okay, which is the calcaneus. Now there are the hamstrings muscle. So there are 3 muscles on the hamstrings group. The most common is the biceps femoris muscle. The hamstrings are located on the posterior upper upper leg, okay, at the back of the upper leg. Often sustain damage in the middle of the muscle belly. So, because it's a long muscle, the damage is always in the middle of the muscle belly or at the musculotendinous junction. Okay, so from the tendons, the junction from the tendon to the musculotendinous junctions from the between the muscle and the tendon, in between, that's the junction close to the ischial tuberosity. Ischial tuberosity is the attachment of the the hamstrings group of muscles. Okay, so there are as well quadriceps or adductors. Quadriceps muscles are the muscles on the anterior portion or the front of the thigh, okay, of the upper leg. Or adductor muscles are the ones on the middle area of the upper leg or the middle thigh. Gracilis is part of the adductors on the middle thigh. Erector spinae muscles are located on the lower back, close to the lumbar spine. These muscles are prone to injury. Okay, so iliopsoas is a group of muscles that are located inside, just at the back of the lumbar spine or inside of the hip bone. Okay, so it may be injured at the attachment of iliacus. Iliacus is one of the iliopsoas group of muscles. Attachment is by the hip bone in the pelvis, on the pelvis, on the upper part of the hips. Okay, or the portion of the lower back, that bone there, or at the combined tendon attachment to the femur. So meaning the attachment of the iliopsoas group of muscles will be at the femur, at the around the greater trochanter and the upper portion of the femur bone on the upper leg. Now, rotator cuff muscles are the muscles on your scapula. Okay, so it helps in stabilizing the shoulder joint and movements of the shoulders, okay, and the arms. Are also frequent sites of strains or ruptures, with the supraspinatus tendon being the most frequent affected. So supraspinatus tendon, or the muscle, are located on the upper portion of the scapula. Okay, so it does the abduction of the shoulder. Now, for the pectoralis major muscle is the biggest muscle on your breast area, your breast muscle. Okay, its rupture usually occurs at the insertion on the humerus. All right, so the rupture is always on the humerus, meaning your upper portion, the bone on your upper arm. Okay, that's called humerus. The long head of biceps brachialis, so your biceps brachialis muscles are located on the anterior portion of your humerus, which is your upper arm bone. Okay, or the transverse humeral ligament. This transverse is the one that holds the tendon of the long head and the short head of the biceps brachialis tendon. It's like it holds it there. Okay, that's the ligament. The biceps tendon into the bicipital groove may also rupture. So that ligament, transverse humeral ligament that holds the biceps tendon in the bicipital groove, so that's like a little It's like a little canal, where the tendons are placed there, and there's like the ligament that crosses it to hold it down. May also rupture, due to heavy lifting, repetitive, strenuous activity. The muscles of the neck in an acute, you know, including the scalens, levator scapula, and the posterior cervical muscles, the infrahyoids, the suprahyoids, the longus colli may suffer strain in whiplash. Whiplash meaning like a motor vehicle accident. Okay, so these muscles that I mentioned are all the muscles that are located on the neck area. Okay, so those are the muscles, right? The symptoms of strain, symptoms of strains. Okay, so during the acute phase, on grade 1, acute meaning it just happened. Okay, acute like from day 1 to like day 7. Okay, grade 1, as I mentioned a while ago, there's at least there's strain on the muscle. There may be a little tear, or there's no tear at all. Okay, so you could see local edema. So on the affected side, you're gonna see like swelling. Edema means swelling. Heat, like if you palpate the area, it's gonna be like warm. And bruising, like redness, are minimal or not present. So minimal, just minimal. You see this minimal or not at all present. There is tenderness at the lesion site. So on the lesion site, where the strain is located, tenderness, a little bit of pain, tenderness. There's little or no loss of strength or range of motion. So at least there may be a little, but most of the time there's no loss of strength, or the range of motion is not affected. Range of motion is movement of the affected muscle. Okay, how far the muscle can move and arrange. The client can continue the activity. So with acute grade 1, the client can still do any activity. Okay, so let's move on during the acute stage for grade 2. So acute from day 1 to like day 7. There is a snapping noise or sensation at the time of injury. We have mentioned this. So this is one symptoms on, during a strain, if you get strain for grade 2. Okay, there's a sound, or you feel this snapping, snapping sound or sensation. Moderate local edema. So there's moderate local edema. Like local means on the affected area. There's local swelling. Heat, like the area is warm. Hematoma, it's like there's bruises there. There's like bluish discoloration, hematoma. Okay, and bruising are present. Okay, the bruising is red. Okay, black and blue. There you go. The hematoma is present at the lesion site. So at the lesion site, you're gonna see the hematoma. Okay, a gap may be palpated in the tissue. So there's gonna be a palpable gap, meaning like there's like a space gap. There is moderate tenderness at the lesion site. So at the very affected site, you will feel pain, moderate pain. There is moderate pain with activities that contract or stretch the musculotendinous units. So you're gonna feel moderate pain whenever you move the area. Either you contract the muscle, or if it's tendon, like that area, the affected site, or you stretch. Whatever movement, then you'll feel moderate pain. There is a moderate loss of strength and range of motion. So now you're gonna feel a moderate, feel a little bit loss of strength, and you feel you're a little bit of, you know, restriction, limited movement or range of motion. The client has difficulty in continuing the activity due to pain. Okay, so you have difficulty now to continue any kind of activity due to pain and experiences disability the next. Okay, so you're gonna experience disability the next day, not being able to use, the affected area for any activity. And there is decreased range of motion, meaning movements of the affected area, any kind of movement, like of the range of motion of the joints crossed by the affected muscle, as protective spasm limits movement. Okay, so once you are restrained during the acute stage, you will always have that muscle protective spasm. That's the one that limits movement. Okay, spasm. Okay. Now, grade 3 strain during acute stage, you'll see there is a snapping noise or sensation at the time of injury. Same thing with grade 2. There is marked local edema, local on the affected side, swelling, heat, warmness of the tissue in the area, hematoma and bruising are present, so bluish or red color on the affected site. The bruising is red, black, and blue. Okay, those colors, you're gonna see those. The hematoma is present at the lesion site, so you'll see hematoma on the lesion site. Sorry, a gap, a palpable gap, is palpated in the tissue. Okay, the muscle is likely bunched up due to a spasmodic contraction, bunch up. So because of the spasmodic spasm, the muscle spasm, then the muscle is bunched up, like it bulged up. Okay, because of the muscle is contracted, shortened. There is also severe pain at the lesion site, so at the affected area, very severe pain. Okay, there is immediate loss of strength and range of motion, so you don't feel any strength on the muscle, and you're not able to do movement. Okay, loss of range of motion. The client cannot continue the activity, so you cannot do any activity at this stage. There is decreased range of motion of the joints crossed by the affected muscle, as protective spasm limits movement. There you go, same thing. Okay, so in grade 2 and 3, the following occurs. The muscle may be bandaged to prevent injury. Okay, so for grade 2 and 3 only, because there's like presence of tear on the affected site. Client may be using crutches or a cane with a strain in a lower limb, or a sling with an upper limb support. Okay, so lower limb strain, or the lower limb, or the leg area, upper limbs, the arm area. Okay, so use sling for the upper arm, for the arms, for the arm area, and for the leg, lower limb, or the leg area. Okay, you're gonna use crutches or cane. With grade 3 strain at the lower limb, so the leg area, the ruptured muscle is usually surgically repaired and then mobilized in a cast for 4 to 8 weeks. Okay, so usually grade 3, there's always, most of the fibers has tears or complete tear. Then the surgical repair is a must. Okay, and the area is, mobilized, is placed in a cast for 4 to 8 weeks. So that's the duration of the cast to prevent mobility of the area. So for healing purposes, it is possible that a grade 3 strain occurs on the upper limb, okay, upper limb, the arm area, and the client does not seek medical attention. It is possible that surgical repair has not been performed. Okay, it's possible this way as well. Okay. Now after acute stage, the early subacute. So following acute. Okay. So for grade 1, the strain has little or no pain and reduced strength. Okay, so early subacute, after the acute stage, after a week, moving to the second week, the early subacute stage, strain has little or no pain and reduced strength. This is only for grade 1. Minimal strain on the muscular tendinous unit, or there's no tear at all. Okay. For grade 2, the strain has pain and moderately reduced strength. Okay, so it's moving to the early subacute. The bruising is black and blue and hematoma is present. So you're going to see these symptoms, guys. There is alteration in the contour of the muscle. Contour, how it looks like. It's altered. Okay, you'll see alteration. The muscle is still bandaged or casted to prevent further injury. Okay, the client is still using crutches or cane with a strain in a lower limb, or may still use a sling with an upper limb injury. Take note, guys, if it's grade 2 and grade 3, this all happens. Okay, so because there's always presence of tearing on the muscle, so there will be a surgical repair and the client could use a cane, crutches, or sling. Okay. Now, for grade 3, strain has pain and marked reduced strength with active resistance strength testing. Okay. The bruising is black and blue and a hematoma is present. There is a gap in the tissue and the muscle may bunch up unless it is surgically repaired. The muscle is still bandaged or casted to prevent further injury. The client is still using crutches or a cane with a strain in the lower limb, and may still use a sling with an upper limb injury. Okay. Now for all grades, to grade 1, 2, and 3, the pain, edema, the swelling, and inflammation are still present but reduced for the acute stage. Okay? Adhesions are developing around the injury site. Adhesions like, tight or hardened tissue that is developing on the affected site. Tendon heals relatively slowly as it is hypovascular. Less pertaining to less vessels on the area. So meaning there's not a lot of blood vessels in the area. That's why tendon cannot heal, and that's why the tendon heals slowly, because of less blood circulation in the area. Okay, the protective muscle spasm diminishes. So the muscle spasm that protects, whenever injury occur, it will be reduced. Okay, trigger points are painful area with you will have a hardened tissue on the area. Mostly it will refer pain to other areas of the body. Okay, occur in the affected muscle. So once the affected muscle starts the early subacute stage, you'll have this happening. It's synergists are muscles that are helper on the same, that does the same action or helps the injured muscle or the tissue. Okay, and its antagonists. Antagonists are those muscles that does the opposite action of the affected or injured muscle. Okay, the range of motion is reduced. So range of motion is the movement of the muscle, the action that the muscle performs is reduced. Okay, so meaning it can is limited. Okay, for late subacute, late subacute, it's followed that it follows the early subacute stage. So pretty much more or less on the third to fourth week, that's late subacute. The bruising for grade 2 strain, the bruising is yellow. It's getting yellow now, green and brown. Okay, the hematoma diminishes. So the hematoma there diminishes. So it disappears. A gap is still palpable in the tissues. There's still gap. Okay. Now for grade 3, on the late subacute stage, the bruising is yellow, green, and brown. Same with grade 2. The hematoma diminishes, so it's no longer, present. A gap is still palpable in the tissue. There's still gap in the tissue. Okay. Now for all grades, the grade 1, 2, and 3, the pain, edema, which is swelling and inflammation, are diminishing. Okay, these are the symptoms you're gonna see. The protective muscle spasms are replaced by increased tone. Increased tone meaning a little tightened or hardened muscle tone, muscle fibers in the affected muscle. Okay, it's synergist, the muscles that helps the same do the same action of the injured muscle, and its antagonist, the antagonist that the muscles that does the opposite action of the injured muscle or strained muscles and tendons. Trigger points occur in the affected muscle and in compensatory muscles. Trigger points, I already discussed this previously. In compensatory structures are those muscles that surrounds the close, that's the action of the injured or strained muscle. Once the injured muscle cannot do the activity, then the other muscles that can do the activity or the action are called the compensatory muscles. Okay, adhesions or taut tissues or in the affected tissue. Adhesions like fibrosis are maturing around the injury. Okay, the range of motion is reduced, so same thing, the movement of the joint is reduced. Okay, now we move on to the chronic stage. If the muscle or the musculotendinous unit is strained and it's been there, it passed acute stage, early subacute, late subacute, then comes the chronic stage. So it's already has undergone healing, okay, on those stages. Now for grade 2, the full range of motion of the joint crossed by the affected muscle may be reduced. Okay, so full range, like any direction of the movement of the joint that is affected by the muscles, the musculotendinous strained tissue, okay, is reduced, is limited. For grade 3, the full range of motion of the joint crossed by the affected muscle may be reduced as well, same thing. If surgery is performed and the limb casted, consider symptom picture under a cast. If the ruptured muscle was not surgically repaired, there is reduced strength since only the synergist, the helper of the muscle, the other muscles that helps, the other muscles or tendons or musculotendinous unit that helps to do the movement of the injured or the strained tissue of the affected muscle can function. Okay. Okay, for all the grades on chronic stage, just read on the information here, guys. For part 2, the subjective component, we have the health history questions. Okay, so there are a few here listed. Just read on this, guys. Other health history questions, just read on this, guys. Continuation for the health history questions, just read on this, guys. Now for part 3 objective component, for the assessment, the observation, you're going to do postural analysis, gait, which is the walking assessment. Okay, now you see for the acute stage, when a client comes to your clinic for treatment, you'll do observation for the acute stage of the strained muscle. You're gonna do this assessment. Just read on this, guys. For early and late subacute assessment, just read on this, guys. For chronic, just read on this, guys, for the assessment. So for the assessment on palpation, for the acute stage, just read on the information, guys. For the early and late subacute, just read on the information, guys. Assessment on chronic stage, we have the information here, just read on those. For the testing assessment, for the range of motion testing on acute stage, just read on this information, guys. For early and late subacute, for the testing assessment, just read on this, guys. For the chronic stage, for testing, just read on this, guys. Now for the special test during assessment, we have some information here, just read on this, guys. Now let's move on to the part 4, which is the contraindications and precautions. So we have a few here, just read on this, guys. For the part 5, the treatment plan, for the acute stage, you're going to assess the severity of the injury and refer for medical attention if moderate or severe. For general treatment, we have goals here. Goals, so just read on this, guys. Additional goal is to reduce inflammation. Okay, just read on the information, guys. So for positioning, pillowing, and draping, okay, you have the information here. Just read on this, guys. For the techniques to use for the condition strain, we have a few here. Just read on this, guys. Now let's move on to special treatments. We have goals as well. Okay, just read on this information, guys. We have positioning, pillowing, and draping, and techniques. Positioning, pillowing, draping, it's going to be the same as the general treatment. Now for the techniques, we have a few here, so just read on the information, guys. Additional information. Now for early subacute, the healing tissue is still fragile. Okay, therefore the treatment goals are achieved with care. Okay, then for the general treatment for early subacute, we have the goals and the techniques. Just read on the information, guys. For specific treatment on that stage, we have goals as well. We have the position, pillowing, and draping. It's going to be the same as the previous. Just read on the information, guys. For the techniques, we have information here. Just read on this information, guys. Other information. So we have hydrotherapy. In acute is cold, such as ice pack or gel pack. Okay, to the injured area. This is during acute hydrotherapy application. Now for late subacute, the healing tissue is less fragile. Therefore, the treatment goals can be achieved using more vigorous techniques. The limb is once again elevated for edema or swelling if present. Okay, general treatment. For general treatment, we have goals as well and techniques. Then just read on these, guys. For specific treatment, we have goals as well and techniques. Just read on the information, guys. Techniques, we have this information. Just read on this, guys. Okay, more information. Then we have hydrotherapy, an application of cold hot contrast local to the injury. Okay, if acute inflammation recurs, the therapist returns to using local cold hydrotherapy application. All right, local to the injured site. Now for chronic stage, we have the general treatment, we have goals to follow, and then techniques. Okay, just read on in the information, guys. Now we have special treatment on chronic stage, we have goals to follow, and some techniques. Read on the information, guys. Other information. So for positioning, we have the information here. Just read on this. The hydrotherapy as well. Just read on this. Now for part 6, which is self-care plan. Okay. So we have goals to follow, and we have hydrotherapy, which is application on site are cold with contrast. The application are cold, warm contrast. Okay. So we have self-massage. We have informations here. So just read on the informations, guys. We have remedial exercises as well. Just read on this, guys. Now let's move on to part 7, which is the treatment frequency and expected outcomes. So the treatment frequency for strain condition, okay, should be shorter. More frequent treatments will address the inflammatory process in the acute stages. Okay, treatment should progress to once a week for chronic stages. Then the client is reassessed. Okay, so for expected outcomes, the outcome is variable. Okay, it varies depending on the severity, how severe the injury is, the treatment approach. So what approach you're gonna use for treating the strain problem of the client, the treatment approach used, strengthening exercises. Okay, exercises to strengthen the affected musculotendinous unit, and soft tissue work, immobilization or surgery. Okay, so it depends on this, and the client's age, okay, is a factor as well, the general health of the client, and compliance with the self-care program. Okay, if the client is compliant with your self-care program, then the outcome of the treatment is always variable. It always varies due to these factors. Okay, so here you go, guys. This ends this video. So thank you so much for watching, and please subscribe, like, comment, and share this video. I hope this video can help you with your study of massage therapy or treatment in relation to massage therapy. And good luck and have a great day.